Cholera is both a health problem and a socio-economic development challenge, requiring a robust multi-sectoral response that ensures universal access to safe drinking water and basic sanitation. As part of efforts to reduce cholera transmission and promote behavioral change, the United States Agency for International Development, USAID, through its Lagos Urban Water Sanitation and Hygiene Activity LUWASH, has awarded grants worth N1.7 billion to 8 local organizations for interventions against cholera outbreak. The grants were awarded to the organizations at a 2-day signing and onboarding workshop in Lagos. The workshop was organized to officially launch the activities and provide relevant orientation for the new grantees. The Chief of Party for USAID LUWASH, Mr. James Rasico, noted that through the initiative, LUWASH aims to reduce cholera transmission, morbidity, and mortality rates in Lagos State.
This round was specifically targeting the recent cholera outbreak. So we requested for solicitations that would address some of the root causes of cholera for prevention. And so this intervention with 7 grantees will be about 1.7 billion naira. Now, we've done a round already about 6 months ago, targeting our more traditional objectives from the LUWASH. That was about 1.1 billion naira. So we're planning another round, and they will target some of the small and medium enterprises that are working in the water and sanitation sector in Lagos. And that will be probably at least 1.5 to 2 billion naira as well. So the LUWASH is very serious about engaging competent, enthusiastic, community-based organizations in Lagos and in Nigeria. USAID LUWASH activity has several components, including working on the infrastructure for the water supply, governance, support to the institutional stakeholders. But through the Grants Under Contract program, it's called the CAREVO Fund, we're able to target specific needs that we've either seen recently, being on the ground for a few years. And through the Grants Under Contracts program, we have a series of calls for solicitations. This is the second call, as I mentioned, directly in response to the cholera outbreak. We plan a third call early next year. And so far, we've engaged, as of today, over almost 24 grantees. And the total fund for the CAREVO is estimated at about $5 million over the 5-year cycle of LUWASH.
Some of the awardees, however, reiterated their commitment in ensuring the objectives of USAID LUWASH were met.
Our program is we're trying to speed up sludge treatment in Oregon fecal sludge treatment plant. We have realized that over time, the treatment plant has been left abandoned. It's an infrastructure that was built almost 60 years ago, and population had grown ever since that treatment plant was constructed. But treatment of sludge as a date is not really being managed properly. So our own intervention is to make sure that sludge treatment is being enhanced so that what is being discharged into the environment that has caused this huge health burden in Lagos is being taken care of from the source. Now we're talking cholera. We know E. coli. We have issues with polio. Polio is also as a cause of fecal oral transmission. Now, we are trying to make sure that we are addressing the root cause of these diseases, because most of the problem, especially in urban Lagos, is as a result of feces not being treated before it's being discharged into the water bodies. That's why we thought about looking at the treatment plan and doing something that will help mitigate these big issues.
The strategy is to reach schools, marketplaces,
motor parks, and the communities with cholera prevention messages and commodities to ensure that we're able to address the cause of cholera and ensure that it doesn't come up again as much as we can. We think this is a very, very impactful project in terms of the developmental outcomes will be massive in terms of addressing the challenge, because it goes to the heart of the problem, getting into the communities, into the nooks and crannies, and building the capacity of community people will now trickle it down to the households and those individuals in the community to ensure that they understand what cholera is, what's causing it, and also how to prevent it, and address it as to where to stem the tide, and also how to prevent future breakout of cholera in the state. And we're working in 7 affected LGAs to ensure that this doesn't happen again as much as we can.
Ours basically is to conduct advocacies and carry out trainings and build capacity of the different communities we are going to be working in. Our basic message would be that let us work together to achieve the goals of the LUWASH. So I believe that the end of the project, or whatever we stand to achieve, will be what the funding.
For 2 days, the grantees were taken through several sessions on understanding their grants, compliance procedures, USAID branding and marking, among others.